Next, we have one of the mental health facility workers that has been doing great work, who wants to speak about some of the trauma that is being inflicted on these children. This is Casey Galavan.
So just to clarify, I don't work in one of these facilities. I came here today first and foremost as a human being, also as a mother, and I am also a mental health counselor. The children that we're talking about here today have already experienced countless traumatic events prior to their migration to the United States. Many of them have witnessed or been victims of gang violence. They have experienced loss, trauma, and abuse. During migration, children and adults are exposed to multiple stressors as they make their way towards safety. Now our tyrant-in-chief is subjecting them to yet another inhumane and violent act of trauma and attachment disruption, as he orders Border Patrol to rip them from their caregivers' arms, detain and imprison them. These children are not political pawns. They're not our prisoners of war to be left in the care of already proven negligent defense contractors. They are children seeking safety and a better life here in the United States. Children who experience chronic stress and attachment disruptions early in life have compounding factors that put them at a higher risk of experiencing emotional, behavioral, mental health, and physical health conditions. If their caregiver is no longer present to buffer the stress during these traumatic events and help the child build resilience, children are more likely to have immediate and long-term emotional and behavioral challenges. In the short term, these children will feel sad and afraid, have nightmares and sleep disturbances, lose their appetite, withdraw from others, and at times have angry outbursts. In the long term, children who are exposed to chronic, prolonged traumatic events and attachment loss experience alterations in their brain development, which include disrupted sleep and eating patterns, increased medical problems, emotional dysregulation, problems with focus, learning, and language development, poor impulse control, anger, aggression, and low frustration tolerance, risk-taking behaviors, and feelings of low self-esteem, shame, and guilt. In addition to this, their overall physical health and mental health outcomes are more likely to be worse in adulthood as a result of these early adverse childhood experiences. We know that folks who have been detained here due to their undocumented status have been neglected, mistreated, and have had their basic human rights violated. The detention of adults, when compounded by uncertainty of its length, is known to cause hopelessness, suicidality, and psychological distress. We can assume that these children, who are now in the custody of defense contractors and unskilled staff members of these so-called nonprofit detention centers, are not trained on how to support and care for traumatized children. They will not treat them with dignity, nor be required to provide them with their basic needs. I watched a video where Antar Davidson, the whistleblower from one of the Southwest Key facilities, described being reprimanded and threatened by a higher-ranking staff member for disobeying orders to tell 3 siblings that they were not allowed to hug each other after having to separate once more after being torn away from their mother earlier that day. It is sickening to know that we are treating these children like federal inmates when they have not committed nor been charged with a crime. There is a significant financial gain for our country to be holding these children in custody, and therefore we are all responsible for the welfare of these children and need to be held accountable to take action now. The last aspect of trauma that I want to highlight is our government's forced assimilation of American culture on these children. They are being forced to remove their clothing and leave their belongings when they enter these detention centers. They are being forced to eat our food, speak our language, worship the fascist who calls himself our president, and learn our whitewashed history. This draws away from one of the primary aspects that fosters resiliency through traumatic events, which is a connection to others or a sense of belongingness to your community and your culture. If these children are to remain in detention centers, tent cities, and foster care, we will be stripping them of their culture and their identity. This is not the first time that we as Americans have done this to human beings who stepped onto our so-called American soil. Our history of traumatization through colonization began the moment we stepped onto this land and claimed it as ours. While the trauma of losing one's culture may be easy for most white Americans to ignore, it is one of the most significant intergenerational traumas that we are forcing these children to endure. Thank you.